All right, so what I will be talking about is a little bit of the history and role of CHWs. We'll discuss how CHWs are part of or can be part of a care team, and what are the competencies and skills required for individuals to conduct that role. I will start out with history and role, and I wanted to mention that I have links on almost all of the slides, as well as additional slides at the end that I won't review that include resources. So I really encourage you to go into the slide deck when you receive it if you want to look at the source material. So the use of lay or community members in trying to extend healthcare access is not new. As you can see in this slide, we have early examples of lay health workers going back hundreds of years in Russia, and then in China with the barefoot doctors. But the use of community health workers really gained traction in the 1960s. In Latin America, there was a movement around empowerment and individuals being able to take control and be involved in their health, and that led to the role of the promotores de salud. And in the US, community health workers and lay health workers began being used to assist migrant workers around their health issues and in Indian health services. So as Kylie mentioned, IHS has been utilizing these kind of paraprofessionals or lay health workers for many, many decades. It wasn't until the late 1970s when the World Health Organization began to define the CHW. And what you'll see is a definition that's quite different than how we view CHWs here in the US. The WHO suggested that CHWs are employed by the communities that they serve. They report to the communities. Whereas in the US, they tend to be either part of community organizations or healthcare systems. In the early 2000s, there was the advent of the patient navigation role or function. And so what we saw over the past 20 years is the adoption or integration of system navigation into the community health worker role in the US. So there has been a recent report through a project called the Core Consensus, or C3, and they've updated the role of the CHW based on current literature and reports and surveys. But the CHW continues to have a primary function as that cultural mediator between a community that's vulnerable or underserved and the healthcare system. And being a cultural liaison allows them to provide culturally appropriate education and information. And then more recently, like I had mentioned, we see that community health workers are often not only connecting people, community members to healthcare systems, but then involved in navigating them through a healthcare system with care coordination and case management. Community health workers historically have served at the individual level and the community level to assist with advocacy, capacity building, and conducting assessments. And also CHWs have been very involved more recently in coaching around health behavior change for chronic disease, self-management, and providing social support. Some provide direct services, so there have been many interventions with using CHWs doing blood pressure monitoring at community sites. Historically, CHWs have been widely used for outreach, and then more recently, evaluation and research. So I've worked a lot with community health centers, and with the advent of the Affordable Care Act, there's this expectation of outreach and enabling services. And they're basically non-clinical services that are important in order to address healthcare access issues and poor health outcomes. And if you look at the types of enabling services available, you'll see that they mirror very well what a community health worker can do. So it ranges from assessing social needs to providing transportation and health education and navigation, among others. Now, we know that across the country there is a big problem with titles, and I encourage you not to worry so much about the position title, but really focus on the function, especially when CHWs or lay health workers are working within a team-based care setting. The scope of work is extremely important. So what is the CHW able to do and going to do versus other members of the healthcare team, and also integrating their role in workflows. So we are moving towards scheduling preventive care visits and visits that allow for focusing on chronic disease self-management support. And the model that I'm showing you here is for self-management support. And the idea is it extends the reach of the clinic to the patient to include before the visit, and that might mean conducting some needs assessment or working around medication. During the visit, where there's coaching and support and building an action plan, and after the visit, where the healthcare team is connecting the patient to peer programs, resources, and conducting follow-up. So the community health worker can be involved in all of these aspects of self-management support at the primary care site. Now, the biggest issue is typically, what can a lay person or an unlicensed person do? And so without very clear guidance at the state level in terms of the role and function, we often have to look at what are the delegation rules. And the delegation principles are typically the task, the circumstance, the person, directions and communication, supervision and evaluation. And I included the South Dakota rules around delegating. So I tend to think about, does the activity that you're considering for a community health worker, does it require licensure? And if it does, then you follow the delegation rules. If it doesn't, then I think through what is the critical thinking required for the activity. And I'll walk you through this. So for example, if all you want is someone to do reminder calls, that can usually be done with some supervision. But if you want them to do reminder calls and also a needs assessment, they probably need some decision aids, a script, maybe some protocols. But if you also want them to then refer to resources, then they might need more training around what are the resources in the community, what is the appropriate referral mechanism. And so community health workers, as well as other unlicensed staff, can be used in many different activities with the appropriate supervision, tools, and trainings. So the Core Consensus Project has developed recommendations for training of CHWs, and you'll see that it ranges from communication skills all the way through to knowledge base. And Riley had mentioned some disease-specific modules, for example, on diabetes, and that is exactly what is needed in order to be able to do many of the activities that require some level of decision-making. But other types of training is needed for if the community health worker is going to work on capacity building among patients and community members. Some states have outlined exactly what the competencies are for CHWs. They mirror nicely to the C3 project, but competencies might be around outreach and outreach methods and strategies, and going on to professional skills and conduct. So in conclusion, you have to be very clear about the scope of practice for CHW. I encourage you not to be, to provide sufficient organizational support for a community health worker to work at the top of their knowledge and skills, and also to help the other healthcare team members work at the top of their license. Sure. The CHWs are really important in terms of cultural mediation. between the health system and underserved communities. We see that historically they've worked both at the individual and the community level. And now community health workers are widely used to not only navigate people to a healthcare system for preventive care or acute care, but also through the healthcare system. And both of those require, different skills and knowledge. They have always provided emotional support and logistical support. They are very effective at both individual and community level educational interventions. However, community health workers do need training and need organizational support given their licensure status. However, with job aids, decision guides, clear workflows, they can be a very, very robust member of the healthcare team. I mentioned that I included a number of resources. So there are a variety of community health worker toolkits out there. Also related to team-based care, there are a number of resources that can help integrating an unlicensed person into the healthcare team and for them to be able to take on duties that probably previously was done by a nurse. There's a variety of resources and toolkits out there. There are screening tools available and for social determinants of health. And there are a number of online modules also available for self-care management, and you'll see at the bottom it says the layperson. So there is a lot out there. I encourage you to take a look and see what we have around the country.